This is Leila Lagandaon, your health education manager here at AI Arthritis, and I am reporting back as a part of our Go With Us to Conferences program for ACR 2023. The session that I'm going to be debriefing on is fertility preservation in rheumatic diseases. Specifically, they do talk mostly about RA and lupus, and I will try to distinguish when they talk about one or the other, but overall, they are talking generally about all rheumatic diseases. And the first section talks about infertility. And infertility is defined as no pregnancy after 12 months of unprotected sex. And the speaker says that 10 to 15% of couples experience infertility. And basically, the things that they're questioning when it comes to fertility is, do we have the choice or not to have kids? Does the disease itself impact fertility, and does medication impact fertility? And female patients specifically in a reported study had said that they are afraid that they don't have the ability to care for a baby because of their disease, that disease or the medications will affect the baby, and questioning whether or not the child will develop disease. And that's like the main concerns. In one study that they showed, it does show that patients with RA take a longer time to get pregnant, about 10% longer than the average population, and 2% more are infertile. So it really depends on what you think about the difference in those, like how much it actually does affect by having RA. Maybe the infertility is not so much, but the time for pregnancy can be longer. Also, they did show that with people with RA that there was no change or significant change in ovarian function. One other thing is that cyclophosphamide really affects fertility for both males and females. If someone is on that medication and wants to pursue getting pregnant, that is one of the biggest things to take a look at. And that there's also a medication called GnRH that can also help to reverse the damage or stop the damage of cyclophosphamide on fertility. So that's recommended to be given if patients are looking to get pregnant. It's also said that NSAIDs may inhibit ovulation and implantation, but it's not significant. For men, sexual dysfunction seems to be higher for those with RA. Sperm abnormalities and anti-sperm antibodies have been found in patients with lupus. And with cyclophosphamide, they recommend for men to go under cryo of their sperm in order to preserve the healthiness of the sperm in that moment. The next section goes into more about preservation for women, but one of the things that she related infertility or like pregnancy planning to is when rheumatologists say that time is kidney, and what if you can preserve the kidney function as early as possible, then you save the kidney. And she was trying to say the same thing, compare it to risk in pregnancy, that especially with higher age, there's higher risk. So a lot of people are starting to preserve their eggs in order to save the age of the eggs at that time if you're not ready to have kids yet. And so that's one of the biggest things they talking about assisted reproductive technologies, or ART. There's ovarian stimulation, intrauterine insemination, transvaginal oocyte retrieval, and oocyte cryopreservation, IVF, all of those different, it's called assisted reproductive technologies. So ART. And ART has really progressed since the 1980s when it first started. And now there's a lot more offspring that are a result of these frozen eggs. And it's presented more often now with younger patients that do want to preserve the age of their eggs, they're trying to say that it should be offered more often and more and earlier, and have that conversation with your patient once they become childbearing age or around that time, to keep it in their mind that this is something that is an option if you do eventually want to have a healthy pregnancy or a healthier pregnancy, less risk for abnormalities or anything else to happen in the pregnancy if the age of the egg is younger. And so I'm going to pull up this on the screen that we have here. So recommendations for AR in women with rheumatic and musculoskeletal disease. So you want to make sure that first they are in remission. That's one of the biggest things. And then do a specific assessment to see which type of therapy would be the best for them. This is, yeah. This shows that the use of ART helps in cost effectiveness and the odds of achieving 1 to 2 live births, even in advanced age. The last speaker goes into more about IVF and how IVF can be modified for the needs of rheumatic disease patients, in, of course, collaboration with the rheumatology team, and that IVF benefits can also help with infertility and fertility preservation, that ART in general is effective treatment for infertility, surrogacy, and prevention of iatrogenic infertility or infertility coming from rheumatic disease. And another interesting tidbit that she mentions is that infertility coverage is mandated in 14 states, not all of them in the US. Check to see what is covered by insurance. I also mentioned that a lot of corporate organizations do cover partial or a certain amount of fertility preservation and AR, so to check in on your benefits for those. Alrighty, I think that was a rundown of what the session was about, having to do with fertility and rheumatic diseases. If you have any additional questions, put them in the comments below, and we will do our best to answer them for you. Thank you again for tuning in to our Go With Us program, and we hope to see you soon.